Hi, this is Beatrice and Shirley. We are your co-directors for Operation Diabetes this 2017 to 2018 school year. We're going to go over the screening process for diabetes at health fairs.
When a patient comes to the screening booth, they will give you their intake form, also known as a health fair screening questionnaire form. It is important to look at question 6 to see if they have ever been diagnosed with diabetes. If they have been diagnosed, skip the risk assessment form and put DM under the ADA risk score column on the log form, which will be taped to the table as well as the intake or questionnaire form. If they have not been diagnosed, you will then proceed to do the diabetes risk assessment form.
Go ahead and ask the patient to fill out the form on their own unless they need assistance, then you may help them. Make sure they answer all the questions and tally up the score. If they have a score above 5, it means they have an increased risk for having type 2 diabetes. At every screening station, there will be a log form.
Here you will put the participant's ID, risk score, and glucose reading after you have screened. For the recommendation section, depending on the glucose value, you will circle the number that corresponds with the recommendations you gave to the patient from their health fair book. If the participant has a glucose level of over 300 milligrams per deciliter, then this patient should be referred to their primary care physician. Additionally, you should record the value in their health fair book so that they can keep it for their records. Remember, when you are filling out any forms and you are using a pen, make sure you do not have gloves on for sanitary reasons and to prevent contamination.
Now let's get started with the screening process. Before you start the screening process, make sure you lay out a paper towel with your supplies. Your screening station should have gloves, a glucometer, test strips, a cotton ball, a Band-Aid, a lancet, and an alcohol pad. Also, make sure there's a sharps container readily available nearby. First, put on gloves. Warm the hands of the participant or ask the participant to rub his or her hands together. Then ask the participant which hand and finger he or she would like to use. With one quick swipe, wipe the finger with the alcohol pad. As the alcohol is drying, put the strip into the meter. Stripe side of the strip goes into the meter. This will then turn on the meter. Make sure to always close the test strip container to prevent oxidation and never leave test strips and glucometers in the sun. You'll see a code. This should match the code on the test strip vial. Also, open the Band-Aid so it is easily accessible after the prick. To prepare the lancet, twist and pull the cap. Choose a location on the finger that's off-center but not too close to the nail bed. Place the lancet firmly on the finger and activate the lancet. Automatically place the used lancet into the sharps container to prevent accidents. With the test strip meter, touch the edge of the strip to the blood drop. Try not to touch the strip to the fingers. The glucose reading should appear in the monitor within a few seconds. Place a cotton ball on the finger and ask the participant to press firmly. Feel free to show the participant his or her glucose level and always remember this value so you can record it later. Place the Band-Aid over the puncture. Clean up your station. Make sure all lancets and test strips are the only things that go into the sharps container. Put everything on the paper towel, wrap it within your gloves, and then throw everything into the biohazard bag. Thank you for watching this video, and we're looking forward to seeing you guys at health fairs.